Bullying is a serious issue for many teens across this country, including a 15-year-old girl, Renata, from South Carolina. But could going under the knife be the right solution, or is it just an extreme measure for a quick fix?
The bullying started around 6th grade. They said that I was ugly, and they said I had a big nose, and they would just laugh behind my back. By the 8th grade, it just got worse.
When Renata started to be bullied by the kids at the school, she became very depressed, withdrawn. She stopped associating with the friends that she had. She just really was hiding from the world.
I stopped going to school because I was tired of getting picked on. I started doing online school.
I did take her for counseling. Counseling was helpful for her problem. The real issue was that Renata was very self-conscious about her physical appearance. She was trying to accept it, but nobody was accepting her.
After we realized counseling wasn't really helping, my mom, she went around and tried getting help and looking for plastic surgeons because I told her it's something that I wanted done. I felt like surgery could make me feel the way I used to and give me more confidence.
Unless you were a parent of a child who's in the same situation, you won't understand what it's like to go through it the way my child has. It was actually the only decision for my daughter, and I wouldn't change it for the world.
Joining us now is Renata and her mother, Michelle. Thank you both for being here. I want to ask you, obviously that's a really, really big step. How are you doing now?
I've been doing amazing, to be honest. I definitely feel beautiful on the inside and the outside now.
Well, the one thing I noticed when I saw the pictures is it really didn't look, like I was expecting to see this humongous nose and this chin, like what I was expecting to see wasn't there. So I think one thing we have to keep in mind is that kids are cruel. And so when you get back to school and you get back in there, they're going to find something else to tease you about. And I want you to make sure that you're strong enough to just be like, you know what, I'm beautiful inside and out, no matter what anyone else thinks, because kids are always going to tease you. And you look fantastic. I'm so happy for you.
I want to bring in Dr. Thomas Romo, the plastic surgeon who conducted your surgery, because I think Dr. Rachel touches upon a really interesting point, which is you have to make a decision as a surgeon. Is this an appropriate candidate to do surgery on? How do you decide when, okay, this is the appropriate candidate, and how much of it is, corrective versus cosmetic?
Well, we have a foundation called the Little Babyface Foundation, and it has a mission statement, which is to provide low-income families with free reconstructive surgery for their children with any facial birth defect. This young lady was beautiful, but she had something called a hemifacial microsomia. One side of her face was significantly different from the other. Her chin was off, her cheeks were off, her nose was twisted, and she went through the application process and was accepted. She came in, she had implants placed in her face to match her face up, had her internal nose fixed and her external nose fixed.
And I think it's important that we make very clear for people watching at home that this was truly corrective surgery. We're not sitting here saying, okay, every teenager out there should be going to get cosmetic surgery. This was something where you were correcting something, and I mean, just looking at Renata, clearly you did a fabulous job, because
the smile you put on this beautiful girl's face was priceless, and I applaud you.
And thank you for sharing your story with us, Renata, okay?
No problem. I love sharing it to help other people.
Well, we're thankful you could be with us today. We'll be right back.
Coming up next.